My name is Heather Vandiver. I am doing summer 2022 women's clinical, and this is my head to toe assessment. It is May 31st, 2022. Let's scan the room first. This is my recorder. My items. This is my patient, Margaret. First, I'm going to wash my hands. My name is Heather. I'm going to be taking care of you today. I'm going to start with a skin assessment, noting the color, temperature, moisture, texture, edema, any edema, turgor, any scars, bruises, lesions, or nevi. Going to note that the head is normocephalic and symmetrical. Going to inspect the scalp first for the hair distribution. Hair color is light brown and coarse, and that there are no infestations or indurations or tenderness or masses. I'm going to palpate over the temporal arteries for any tenderness. I'm going to palpate the lymph nodes, starting with the preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Then going to palpate over the jaw for any TMJ, noting any crepitus, subluxation, or tenderness. You can clench the jaw, open your mouth. Okay. Next, I'm going to assess cranial nerve 5. I'm going to have you close your eyes, assessing for light touch. Tell me where I'm touching.
Forehead, nose, cheek, chin, cheek.
Okay. Then I'm going to assess cranial nerve 7. I'm going to have you lift your eyebrows up, close your eyes really tight, smile and show your teeth, frown, puff your cheeks out, and pucker your lips. Cranial nerve 7 is intact. I'm going to move to the ears, noting that the ears are symmetrical with no masses, palpating the pinnae and tragus bilaterally for any tenderness. I'm going to inspect the auditory canal bilaterally, noting no erythema. The tympanic membrane is gray and pearly and intact bilaterally. Going to assess cranial nerve 8. I'm going to have you cover your left ear and repeat what I say. 99.
99,
Repeat what I say on this side. 60.
60,
Okay. I'm going to then assess the whisper with the whisper test that I just did, the Weber test for lateralization. I want you to tell me if you can feel on one side or the other more.
both sides.
Okay. I'm going to assess with the Rhine test. I want you to tell me when you stop hearing it.
Okay. Okay.
Noting that air conduction is greater than bone conduction bilaterally. So I'm going to move to the eyes. I'm going to inspect the lashes, eyebrows, and palpebral fissures. I'm going to inspect the sclera and the conjunctiva for any discharge lesions and the color, noting that they are white and non-icteric. Then going to assess cranial nerve 2 for gross central and peripheral vision. I want you to tell me the lowest line you can read bilaterally.
LTFPH,
Cover your left eye.
LTPFH,
Cover your right eye.
LTPFH.
Okay, noting that the vision is 20/20 bilaterally. I'm then going to cranial nerve 3, noting that the pupil's response to light is equal and reactive, and it is. I'm going to assess for accommodation and convergence, which you follow my finger. Okay, and then assessing cranial nerves 3, 4, and 6, extraocular movements. I want you to follow my finger. Peripheral vision also. I want you to tell me how many fingers I'm holding up.
4, 2, 1, 5.
Perfect. And then I'm going to assess the red reflex. Next, I'm going to move on to the nose, noting that it is midline, straight, without deformity, and symmetrical. Noting nasal patency, if you could hold one side of your nose and sniff, and hold the other. And close your eyes for me. I'm going to assess cranial nerve 1. Tell me what you smell.
Coffee.
Going to palpate over the frontal and maxillary sinuses for any tenderness. Okay. Next, I'm going to move into the mouth, inspecting the lips, teeth, gums, tongue, buccal mucosa, soft palate, hard palate, posterior pharynx, under the tongue. Assess cranial nerve 9 and 10. Have you stick out your tongue and say ah. Noting that the soft palate and uvula rise with phonation. If you stick out your tongue again. Assessing cranial nerve 12, noting that the tongue is midline without fasciculations. Next, I'm going to move to the neck, noting that the trachea is midline. I'm going to, if you'll turn to the side for me, I'm going to palpate the thyroid. You swallow for me. No nodules are present. I'm going to palpate the carotid artery bilaterally, and they're equal bilaterally and 2+, and auscultate over the carotid artery for any bruits. Okay. Next, I'm going to move to the posterior chest. I'm going to start here by once again noting the skin color, texture, moisture, temperature, any edema, scars, lesions, nevi, bruising. Would lift her shirt up and assess that. I'm going to assess for symmetry and any deformities or any increased work of breathing, any signs of respiratory distress like increased rate or tripod positioning or nasal flaring. None are present. I'm then going to assess symmetrical chest expansion. Take a deep breath. I'm going to assess for tactile firmitus, say 99.
99. 99.
Okay. Then I'm going to percuss over each lung field. Okay. Going to auscultate over each lung field. Deep breath when you feel my stethoscope touch you. Making sure to get the lateral lung fields as well. Next, I'm going to assess for egophony. Whenever my stethoscope touches you, if you'll say E.
E. E. E. E. E. E.
Now assessing for bronchophony, if you'll say 99.
99. 99. 99. 99. 99. 99.
And now assessing for whisper pectoriloquy, if you'll whisper 99 for me.
99. 99. 99. 99. 99. 99. 99.
Okay. Next, I'm going to move to the anterior chest. Once again, noting the skin. Going to note symmetry, any abnormalities or any signs of respiratory distress again. None are present. Going to assess for symmetrical chest expansion. Deep breath. Assess for tactile firmitus. 99.
99.
Okay. And then I'm going to auscultate each lung field anteriorly. Deep breath. The lateral lung fields as well. Okay, and then I'm going to assess the heart valves with the bell and diaphragm of the stethoscope, starting with the aortic, pulmonic, Erb's point, tricuspid, mitral, aortic, pulmonic, Erb's point, tricuspid, mitral. Then I'm going to assess over the PMI. Listen for a full minute, noting the rate and rhythm. It is a regular rhythm with a rate of 70 beats per minute. And then going to have the patient lay at a 30 to 45 degree angle. You will turn your head to the right for me, assessing for any jugular vein distension over here, and none present. Any jugular vein distension on the right, none is present. Going to assess for any heaves or lifts on the chest wall, none are present there. I'm going to palpate for thrills over each of the heart valves again, aortic, pulmonic, Erb's point, tricuspid, and mitral. Then listen to those again with the bell and the diaphragm while the patient's laying down. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay. Next, I'm going to move to the abdomen, noting the skin of the abdomen again, the color, the texture, any edema, moisture. I'm going to note the contours and symmetry of the abdomen. Then going to auscultate over the aortic artery, renal arteries, iliac, femoral. I'm going to auscultate bowel sounds in all 4 quadrants, noting that they are normal active. I'm then going to percuss for any flatness, tympany, or dullness. And to palpate for any masses or tenderness. No?
Sorry, tickles.
Palpating the spleen. Take a deep breath in. And the liver. Okay. And then I'm going to have you sit up for me, and I'm going to assess for CVA tenderness. Tell me if you have any tenderness here. Here? Okay. You will face forward to me. Now I'm going to assess the upper extremities for the joints and the skin. I'm going to inspect the joints for any redness, warmth, swelling, tenderness, nodules, or deformities. I'm going to start by assessing the capillary refill, noting it is less than 3 seconds. Checking the radial pulses bilaterally. They are 2+ bilaterally and equal. Going to have you test the range of motion of your fingers. So I want you to flex, extend, hyperextend, abduct, adduct, thumb opposition. I'm going to do the same for your wrist. I want you to flex your wrist, extend, hyperextend, rotation, radial rotation, ulnar rotation. And then I want you to flex your elbows, extend your elbows, no hyperextension present. I'm going to test the strength of the hands. I want you to squeeze. Strength is 5 out of 5. Test the strength of the biceps. Okay, and the strength of the triceps. I'm also going to assess cranial nerve 11, having you shrug your shoulders against resistance. And I'm going to test the strength of the shoulder girdle. If you'll hold your arms up like this, try not to let me push you in, push you out. Strength is 5 out of 5 there as well. Next, I am going to assess over the radial malleolus for the vibratory sensation. I'm going to assess light touch of the upper and lower extremities. Feels the same on both sides?
Mm-hmm.
Same on both sides?
Mm-hmm.
Okay. Now, range of motion of your shoulders. I want you to flex, extend, hyperextend, circumduct, inward rotation, external rotation, okay, adduct, and abduct. Perfect. Okay. Now I'm going to move over to your hand opposition. I want you to move your hands as fast as you can up and down. Perfect. Touch your fingers to your thumbs as fast as you can, and then touch your nose to my finger. Okay, perfect. Now, going to move over to the deep tendon reflexes. Do the brachioradialis first, bilaterally. A bicep, bilaterally. Tricep. Okay. The patellar. Achilles and Babinski bilaterally. And all reflexes are 2+ in normal. Then going to move on to the lower extremities, noting that the skin is intact, no bruises, scars, lesions, or nevi. There's no edema present. The color and turgor of the skin is good. I'm going to first assess the capillary refill, noting that it is less than 3 seconds. Assess the dorsalis pedis pulses, which are 2+ and equal bilaterally. Posterior tibial pulses are 2+ and equal bilaterally as well. Then going to move on to the range of motion of your toes. If you can flex them and extend and hyperextend, abduct out and abduct in the best you can. And your ankles, I want you to plantar flex, dorsiflex, internal rotation, external rotation, good. And then I want to test the strength of your ankles, push against me, pull against me, the strength of your knees. Okay, perfect. If you will stand up for me, we're going to test the range of motion of your knees. So bilaterally, flexion, extension, flexion and extension. Then we're going to test the range of motion of your hips. We're going to do flexion bilaterally on both of those, extension and hyperextension. Do circumduction, small circles with both, internal rotation with both, external rotation. All right, perfect. And then we are going to assess the spine. You will bend over and assess the curvature of the spine, noting that it is straight with no curvature present. Have you stand up for me and assess the lumbar range of motion. Flexion she just did, so extension standing up, hyperextension back, left lateral flexion, right lateral flexion, and then rotation for me. We're going to assess the range of motion of the cervical spine. You will bend your neck forward, flexion, straight up, extension and back hyperextension, left lateral flexion, right lateral flexion, and rotation as well. Then if you will turn towards me and assess for Romberg's, I want you to close your eyes, noting that there is no swaying present. Okay, you can open your eyes. I want you to walk to the door. We're going to note that the gait is regular, and if you will walk heel toe back, noting a tandem gait is regular, and hop on one foot, hop on the other foot, and that completes my exam.